Hello, this is Farah Douglas, President and CEO of the Liver Health Foundation. Thank you for joining us this afternoon. Liver Health Foundation is a California-based entity. Many of the members of our boards of directors represent liver patients and caregivers. Our Medical Advisory Council benefits from the experience, knowledge, and kindness of over 30 members who are some of the best hepatologists and liver specialists in the United States. Our mission is to provide accurate and updated information on liver health, promote prevention of liver disease, advocate for quality patient care, and host community and physician-centered educational programs and events. To learn about all of our programs for 2022, please visit our website at liverhealthfoundations.org. Please note the information Liver Health Foundation is providing today is not a substitute for advice from your own physician or healthcare provider. We do not endorse any hospital, doctor, or treatments. Now, we are very thankful for Albireo Pharmaceutical support. Albireo's educational grant has made this webinar possible. Albireo Pharmaceutical is the maker of Belvi. Belvi is the first and only IBAT inhibitor FDA approved for pruritus or itching in PFIC. I want to say a little bit about why we are starting this new series. Tonight's program is actually the third installment of our new series that we call A Patient's Journey. We wanted to, during these webinars, to move away from talking about actual disease and available treatments, and instead focus on patients, caregivers, experiences of living with liver disease. We will show life after liver disease, and hopefully you will see the light at the end of the tunnel. We also want to create a platform for all liver patients and their caregivers to share their stories and ask questions from our doctors. Our hope is that these webinars will bring hope to all liver patients and provide an opportunity for all of us to see liver disease through the eyes of liver patients and their caregivers. It is now my distinct honor and pleasure to introduce our MC and host for tonight's webinar to you. Dr. Rohit Kohli is the Chief Gastroenterology, Hepatology, and Nutrition. Director, the George Donnell Society for Pediatric Scientists. Endowed Chair in Liver and Intestinal Research at Children's Hospital, Los Angeles. We know the hospital as CHLA. Professor of Pediatrics, Clinical Scholar at Keck School of Medicine, University of Southern California, USC. Dr. Kohli's research work has focused on the pathogenesis of obesity-related fatty liver disease, or NAFLD, and the role of bile acid signaling as a mechanism for NAFLD resolution after weight loss surgery. His work has also shed light on reactive oxygen stress in the generation and regulation of the extreme stages of NAFLD, which is known as NASH. Dr. Kohli is the recipient of a fellowship award from the American Association for the Study of Liver Disease, or AASLD, Takeda Research Innovation Award from the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition Foundation. Dr. Kohli, thank you again for your time and your support. Would you please start the program?
Thank you so much, Farah. You're always so kind in your introductions. So today is not about any one of us, but we would like to actually shed light a little bit more on the family dynamics and the life of a child and their caregivers going through the journey of PFIC, or progressive familial intrahepatic cholestasis, the long form. Our guest tonight is Miss Susan DeAngelis. She is a strong person and a mother of 2 children who are now living actively, and she'll tell you more about them, with PFIC. She has 3 children altogether. We'll learn about them, as all 3 of them, but 2 of them unfortunately have PFIC. Can we turn the camera and so there we go. Good evening and welcome, Ms. Susan DeAngelis. Please, if you don't mind, go ahead and introduce yourself more than I've already done. This is your evening.
Hi, my name is Susan DeAngelis. I have 3 beautiful girls, and my husband is named Carter. I guess before this whole thing started, I grew up in California in Valencia. I grew up dancing, ballet, and competing in all forms of dance. And then after I graduated high school, I moved on and danced with the Boston Ballet and the Joffrey Ballet. And then I met my husband and we got married, and we had my sweet Cosette, who is 6 years old. She does not have PFIC. Everything was super easy, fun. And then I got pregnant with Sylvie. And Sylvie, she originally had something wrong with her brain, which was an intracranial cyst called Dandy-Walker syndrome. And so we were very tunnel vision on that story for us at CHLA. And we went through a lot of struggles with her in that she had to have a craniotomy at 5 weeks old. And then as soon as we brought her home, around 3 months, we started seeing her jaundiced. And that's how that whole thing came about. And then 4 years later, now I have a 4-month-old named Genevieve, and she also has PFIC.
Yeah, it's been definitely a journey. Can you tell me a little bit more, maybe in the people who are in the audience, more importantly, about how different those 2 experiences were? We'll get to Genevieve in a minute, but maybe between Cosette, your firstborn, who does not have PFIC, being pregnant with her and having her grow up in front of your eyes, and then having to deal with not initially one insult, but then quickly thereafter, the new diagnosis of PFIC, which is much more what we're talking about today. Kind of contrast them for us.
Sure. Cosette, we were so excited with her. She is beautiful and super healthy. And every time I'd go to our pediatrician's office, it was very exciting. She always would hit her milestones even before. And I think I was nervous as a first-time mom, but it was more of, okay, when is she going to do this? When is she going to do this? When is she going to walk? When is she get, I was just more excited about that portion of motherhood. I was still working a lot. I was a dance teacher. And so I really was focused with both of those things. And then when Sylvie came along, it just kind of made me take a step back and almost slow down in a way of just, you really just have to worry about what's in front of you instead of worrying about the future. You just kind of have to go one day at a time with a child who's sick. And I think that has helped me in life in general, is just that you have to take every day, the wins of that day, get excited about it, move on to the next day. Or if it's a bad day, know that the next day, hopefully it would get better. So I think just with those, the contrast of both of those, my girls, it was, it's just
stark, pretty stark. And I hear you about the chronic disease, whether it's liver disease in this case, of course, or disease originating in the liver, or elsewhere. Chronic disease is impacting probably everybody in the family when it impacts one person in the family. So maybe talk to us a little bit about the process that you went through on, I mean, I can speak to ad nauseum about the physician's or the practitioner's perspective about a workup. Like, let's send the genetics and we'll see you in 4 weeks. Tell me how those 4 weeks were for you as a mom waiting for, anticipating for a real final diagnosis.
Yeah, I think we spent most of our time waiting for the diagnosis in the hospital. Sylvie had very severe hypoglycemia and we couldn't get that under control. So while we were waiting for that genetics panel, the cholestasis panel, to come back, it was more of just everybody shooting things out of the dark. We didn't really know what was happening. And there's a bunch of diseases I think we had discussed in the hospital. And, you know, there's some that were maybe she could grow out of, maybe there was some that it was just some infection, or then there was, you know, the doctors have told me there's some that are like pretty brutal, which one was PFIC, one was there's 2 other ones. And I just remember being like, I hope that it's not those 2. I hope maybe it's just an infection, but because it had been going on for so long, I think it made me just digest that it probably was one of the worst ones. And seeing her go through it, it was almost a relief to have a diagnosis, but definitely not knowing for treatment options, that was the hardest part, just because she had to go through a lot of tests and biopsies and PICC lines and all the things. That was hard, not knowing what to do.
I can't even imagine being in your shoes. The words that we speak may come out one way and you may hear them differently when you're in the middle of trying to understand. All of us are trying to understand what the diagnosis is, why one child is slightly different in the same genetic mutation, for instance, right? So you mentioned briefly, I think, why you came back in. You said jaundice. So how did you pick up on that? What was the tip off?
I remembered that my friend had a baby and her baby was jaundiced, and they did the under the Billy lights or they took the Billy blanket home. And I just remember that was very newborn. And then when we had Sylvie at home and she was 3 months old and she was very highlighter yellow, I put my hand up to her belly and just looked at the difference of color, and I just knew something wasn't right. And so I immediately called my pediatrician, and thank goodness I had a great one. And that's definitely a top priority for us, is just to have somebody being able to call. And he got us in right away, got us blood work immediately. And then her Billy number was pretty high, and her INR was ER worthy, and that's what sent us in.
Those can be scary times when you're completely out of the blue, lightning strikes you kind of thing, right? And then you spent, of course, you walked us through almost a month in the hospital trying to stabilize her glucose levels and then waiting for a diagnosis. So once you had the genetics come back, once you had a diagnosis, what did that feel like? How did you talk about it in the family? How did you go about understanding that? What does it mean to you?
Yeah, I think I didn't really pay attention that much in school about genetics. I always knew it was interesting, but it really led me down a journey of figuring out why this happened. And just knowing that it wasn't my fault, technically. It was just a weird luck of the draw type scenario. And I think just having the diagnosis helped, but you also have to mourn the fact of that you don't have a healthy child, and it's not an easy fix. It's something that you really have to, figure out. And with PFIC, especially my daughters, it's the fourth one. So there's not as much as PFIC 1. So it's when she got diagnosed in 2017, it was really just, there was a few things that we could do to keep her at bay, but it was really knowing that she would probably have to get a liver transplant. And that, I think that was the most daunting thing for me. It was just a dark cloud looming over my head, was just always knowing that she might have to get a liver transplant. So that, I think, was the hardest part about the actual PFIC diagnosis.
No, and just for people who are not living or studying PFICs, essentially, we're talking about a constellation of diagnoses. The alphabet may be the same, but once you add the numeral to it, every disease that falls under this umbrella of PFIC, whether it's 1, 2, 3, 4, 5, 6, we keep adding. Actually, the other day I was talking to someone who I consider pretty much a mentor for myself in bile acid biology, and we said, bile acid synthetic defect should be PFIC 0, because that's where it all starts. And if you have a genetic mutation in bile acid production from cholesterol, where it all starts, but you can't do it, then maybe that's 0. That's ground 0. But nevertheless, I think that the point I'm trying to make is that this is an umbrella. There's a variety of different problems associated with each different numeral. So PFIC 4, which is what 2 of your children have, is something very different than, say, somebody who had PFIC 1. They're completely different disorders, even though the pathways affected may be similar. So in terms of at that time, we probably talked about a couple of different things we would do for Sylvie in terms of making her symptoms better. And yes, we had the kind of dark cloud hanging over us for liver transplant. Did those few things that we did early on really help? And be candid, please.
I think the Ursidile helped me see on the blood work. It got the jaundice pretty much at bay. I would say that the itching, it helped, but it didn't stop it. And then we added rifampin, and that helped for a while, and then it didn't. It's different with every child. I'm on a Facebook group with a bunch of PFIC mothers as well. And as you said, we're all different, 1 to 6. So all of us have different stories to tell. But yeah, I think that we kind of had to do a lot of figuring out what dosage, what works. Is this really, should we even bother with this? Or, and then when she had the severe hypoglycemia, we were also putting cornstarch in her milk to help her keep her blood sugar. So it was just, we didn't know if maybe like the cornstarch was making her bowel movements different because of that, or was it because of PFIC? It was just trying to figure out some type of regimen that would keep her comfortable. But I would say that when she gets more, if she gets sick, if she gets cold, the itching gets really intense.
Yeah, I remember when I was in training back in the early 2000s, we used to talk about certain disorders that produce a lot of pruritus, a lot of itching, and a lot of childhood liver diseases do that. So it's a common problem. So we have this kind of stepwise approach in most practices, most people's practices, that you'll try A, B, and C. And none of them are perfect or were perfect, but we had to do with what we had and do the best we could. And then luckily there was a new set of medications that have come around, right? And you were able to, these are bile acid reuptake inhibitors, which basically block the bile acids to go back into the system at the intestinal level. So you just poop out your bile acid, so to speak. So what experience have you had with that kind of category of medications?
We have had amazing results. Sylvie is on a trial. I specifically went the trial route because I wanted to give doctors as much information as possible, since this is a rare disease and I want people to care. So we went through that route, and the study was blind, so we couldn't see how it was helping. And then when we were able to, it was almost a miracle just seeing her numbers, the almost completely normal. The itching is non-existent. The only time I would say she ever itches is if she gets a cold, and it's minimal, but throughout the day she can go to preschool now. I don't have to worry about her itching at night. She's sleeping through the night. A lot of times it was in the bath or when skin is exposed, and we live in Arizona, so it gets really hot and the heat does not help as well. So seeing that drug being able to do that for her has been an actual miracle.
I'm glad. The first thing I'd say is thank you for stepping up and being part of clinical trials. I think a lot of parents have benefited, a lot of children, and through them their families have benefited because of individuals and families such as yourself who have stepped up for science. So thank you. Secondly, I'm glad that the trials worked, and these medications are now going through, and some have gone through FDA approval for PFIC. So we, of course, feel safer with all that data being available to us and looking backwards. But then you got pregnant again. What went through your mind? Tell us about that.
I think my husband and I always had talked about having more kids after Sylvie. We actually went through the route of maybe in vitro, seeing if we could test my egg to see if that had PFIC, but he said once they go together, it could split and still happen. So I didn't want that route, and I knew it was a 1 in 4 chance. So we decided not to have any more kids. And we've always had a heart for adoption as well. So we were going to go that route. And then one day when we saw how great Sylvie was doing, we started thinking about it again. And faith is a big thing in our lives. So we prayed about it a lot, and we decided, well, let's just try for 2 months. And if nothing happens, then that's fine. But if it does, and then we got pregnant, and we got Genevieve.
They are blessings. We have 3 children as well. I think we've talked about this before. And I was, before marriage, before I met my wife, I was like, I'm going to have 1 child and that's it. And then she came from a big family, and so did I, but I had different response to a big family. And she wanted to have more. So we have 3 now, and I think each one's a blessing, like you said. It's amazing. So Genevieve comes around, and obviously it's good news to have a new child in the house. And then you noticed something, or what changed?
Yeah, so I think in the back of my mind is always looking out for different markers. And as I said, with Sylvie, I didn't see jaundice in her until 3 months old. I did see itching in her before that. I'm not sure if that was due to her having brain surgery and having a lot of medication in her. Maybe that brought it on, but she was very much, she would always be itching her face when I would feed her. And then so when Genevieve came along, I made sure to be really on top of it and see any signs. And at 5 days, she was jaundiced. And I went to our pediatrician, and I looked at her and said, oh gosh. She goes, well, it's 5 days. She's 5 days old. So maybe it's just actual neonatal jaundice. And I said, okay. So we did a Billy test. It was normal, almost a little bit over normal, but pretty normal. And then we just kind of watched her. And then probably around at 3 weeks to a month, it got worse. It started in her face and her eyes, and then it started going down. And as soon as I saw it kind of going into her arms, I knew that we needed to go see a hepatologist. So
yeah, you obviously had the prior exposure and you understood. No, this is actually for people who watch this afterwards or online today. This is actually something important that you just mentioned. You observed yourself that the itching started first. And we don't know a lot, but we know some things. And one of the things we know is that itching can be part of the sluggish flow of bile. And bile has many components. There's cholesterol and lipids and stuff, but the two things we talk about a lot are bile acids and bilirubin. They're two very different things. And the sluggishness of the bile flow affects badly the bile acids faster. So the itching, we think, correlates, at least, we don't know about cause, but at least correlates with bile acids. So, but the bile acids don't give you color. Bilirubin gives you color. So you notice the itching, which we know to track better along with bile acids first, which happen to rise first when there's sluggishness of bile. And then you started to see the color change, which tracks more, of course, with jaundice and bilirubin. So that's very interesting that you noticed that. We understand that, and I think it's good for people at home who are listening to have that in the back of their mind. If, most of the time when we think of itching in children, we're talking about allergies or eczema, of course. But in a child who has a sibling who has liver disease, or a family history of liver disease, or if you see itching and pale stools, where the bilirubin has left the normal cycle and it's not giving color to stool anymore, but rather the skin is changing color and it's backing up and the eyes are changing color. Those things you need to put together. And looks like you already did with Genevieve. So you went to this.
Yeah, I think too, which was interesting that you said that, was maybe if it was flip-flopped and Sylvie had jaundice first and then itching, it would have been a little bit easier, because I remember when she had all of her brain things going on and she was itching, it was very hard for me to explain to doctors that it wasn't a normal itching, because they all prescribed me eczema medication, and on her blood work it wasn't showing up anything because her bilirubin was okay at that time. But maybe I don't know, but you probably don't test for bile acids just in normal workup. So she could have had some crazy elevated, and we didn't. Maybe that's something that, if they're itching and stuff, that's something to ask for in the future.
Yeah, we're definitely learning more and more as we go along. That's one thing that is not routine. You're right, at the present time. So tell us about testing for Genevieve. How did that start then? Once you had that identified and you got the bilirubin, it was not that high, you said. And what prompted you to go full force into genetics straight away?
Yeah, so once it started going down into her body, we met with a doctor that we know, and he tested her. And I went home and he called me that night, got the results, and told me to come get admitted because her INR was high, which is exactly the same as Sylvie. She got a couple vitamin K shots. It went back down and we got to go the next day. Then after that, we immediately were just like, let's do the genetics immediately, get that going, because it does take a little bit. And from that point on, we just kind of treated it as if she already had PFIC4. We pretty much knew that it was going to be, I think you looked at me in the hospital when I was there and was like, it's probably going to be that. And I said, I think so too. So it gave me, time to grieve that child too. And while we waited, so when I did get the confirmation that she did have PFIC as well, it wasn't a huge shock. And I could talk to the geneticist more in depth about things. I'm queen of Google. I love to figure out my own thing. I have to pretend I'm a doctor and tell people things. And so I was looking at our genetics, and I was able to answer or ask questions to them, and they could answer some more in-depth things that maybe when I got the first diagnosis with Sylvie, it was more of a shock. And this time, since it wasn't a shock, I could just ask some more interesting questions about my genetics, my husband's genetics, and now my kids. Because I think a big one for me was I thought that Sylvie and Genevieve would have the same probability of having a child with PFIC as me and my husband, but that's actually not true. So that was something that day was kind of a bright. I was skipping out of the genetics, hearing that their child probably would just be a carrier. So so that was,
it's very important. That's very important to pass along to people. A couple of things. The genetics piece, most of these disorders are what we call recessive in terms of inheritance. So we all mostly understand that a part of our genetic material comes from our mothers, and a part comes from our fathers. And in recessive disorders, you have to have the same defect or at least additive defects on both sides for you to have that full-blown disease if it's a recessive disease. However, if you have a recessive disease, you're going to only pass on one broken piece. You're not going to pass on both. So that's a good thing to understand. And every time you have a child, it's the same odds, right? It's 1 in 4, like you said, because it's not iterative, it's repetitive. So it's the same chances every time we're going through that process.
genetic
Unfortunately, yeah. So one other thing that you mentioned for both of your children, that they came in with elevated INR. And just for people who don't know what that means, it's a measure, it's a blood test that we look at for the clotting of blood. And there's 4 vitamins that are what we call soluble in fat or fat soluble vitamins: vitamin A, D, E, and K. And you mentioned that they got vitamin K shots and their clotting time got better. It's because when you have jaundice, such as PFIC4 can produce, and bile acids are not flowing well and bilirubin's not flowing well, you will not absorb these fat soluble vitamins because you need these bile acids to bind with anything that is fatty for it to be absorbed properly by the body. And so they become vitamin A, D, and K deficient. Vitamin K specifically is important for producing proteins from the liver. It's a substrate, is a raw material that the liver needs to produce clotting products, clotting factors, clotting proteins. And when you don't have vitamin K, you don't have the product, you don't produce clots, and your clotting function goes haywire. But we can replace it by giving shots of vitamin K because you don't need to absorb a shot. It's already in your body. So you did pick up on that. I think it's I think critical for me as a caregiver as a practitioner and partnering with families to make sure they understand something you said very nicely up front. It's not your fault, right? These things, these genetic disorders, these rare conditions, we're talking 1 in thousands, sometimes hundreds of thousands, and some other conditions, not PFIC, but some 1 in a million, right? These are just random events that people have different colored eyes and people have different color skin. Those are also random events, shades and so forth. So I think what we're looking at is not anybody's fault, but we're trying to make the best life possible for them. So tell us about their lives right now. Let's now that they're both diagnosed, one you said was on the medicine, the second one is also on medicine now?
She is on one that Sylvie was previously on before, and now she just got screened to be on one of the inhibitors. So that's super exciting, and hopefully we will receive that next week. And yeah, and so that is hopeful for us, and talking with our doctors as well, because Sylvie didn't get on that inhibitor until she was last year, so she's 4, and Genevieve will be 4 months. So it would be kind of interesting seeing how that affects her long term, since she really doesn't have probably that much damage to her liver now. So that's exciting. But Sylvie is in pre-K. She used to go half day, and she asked to go full day. And so now she's going full day, because she was the only one that went half day. So she is very excited to be with her friends all day. And she is a little dancer and loves.
Don't know where she gets that from.
Don't know. I have no idea. She loves music. She loves to sing. And Genevieve is just along for the ride. She's the 3rd child. She has to go in the car seat everywhere we go. She goes. And she doesn't really cry. She smiles at everyone. She's just a little gift. So yeah.
Nice. How do the two older sisters interact with the baby?
So my oldest, she couldn't even care less that Sylvie was born. And so with this one, I was a little nervous, but now since she understood and she could see me pregnant and kind of understand that there was a baby growing in my belly. When Sylvie was born, she was not even 2 yet, so she had no idea. But they both are loving being big sisters. They love pretending that that's their baby and they're the moms. I definitely would trust Sylvie more with the baby than Cosette. Cosette's kind of like, I'm gonna go play outside now. And Sylvie's I need to feed her bottle. She needs her passy mom. She's telling me what to do. It's amazing. I love it.
Now, does Sylvie understand that Genevieve has a diagnosis or no?
She does. So we were praying for her, that, hopefully she, we pray for Sylvie every night that her liver disease doesn't affect her, and, she stays healthy. And when we told Sylvie that Genevieve has, I always said she has PFIC too. She's going to take new medis just like you. And she's like, I have a best friend now that has a liver disease. So, it's sad to hear that, but at least they do have each other. And Sylvie really did pave the way for Genevieve and for me to be able to understand what to do and where to go for this diagnosis. So, it's sad, but it's cute that they have each other.
It's heartwarming, but I think I hear what you're saying about being sad as well. What do you look forward to, and what do you forbear in the future of?
I think the thing I most look forward to is just seeing how this won't affect them. I think right now, since we're really trying to get everything figured out in terms of medication, and Sylvie is we're pretty stable with her, and that's awesome. I just want Genevieve to be stable as well. And then I just don't really want it to be a thing we think about. Sylvie has been on medication since she's been 3 months old for this. So, it's very ingrained in my body to what times I'm giving it to her. And of course, one medication is no food and one medication is with food, and both have to be refrigerated. So, flying for the first time and putting like my medications in an ice pack with a Yeti on it and putting it in, trying to figure all that stuff out was hard. But I think that once we get Genevieve on the right track and not having to keep going back to the hospital for monthly like blood work and all that stuff that we are doing right now. I'm just looking forward to not even it be an afterthought. They take their medication like they take a vitamin, and they just go on their day.
I hope so. I hope so. Is there something you fear in the future?
I think before I did, I think the fear was the transplant. And for some, it is a miracle. That is their miracle. And I think now that we have more choices and options, I think that's exciting. So I think the fear has gone away because they're not, both of my kids right now are not, it's not a life and death thing currently, thank the Lord, but I don't think I'm not scared anymore. I definitely was at that point at one time, but now I'm good.
Yeah, you're better. You're better. No, but I do want to reassure you and anyone who's listening that transplant is for children, if needed, if necessary, is also an established treatment modality. It's only obviously used when and there's no other resort and when push comes to shove, but it's there and outcomes are great. Children grow up, become adults, children become parents, go to college, go to med school. There's this very nice story about a child who got a transplant, and now she is a liver transplant doctor. So giving back the same way, there's a child who had a liver transplant who I know she is a liver transplant nurse. So there's definitely, I understand the fear and the trepidation, but there are great stories post-transplant as well. We wouldn't do it if we don't need to, of course, but if we need to, it's there.
Yeah, I think too the fear of I'm very much a type of person that needs a way out of everything. And so now knowing that we have options, and liver transplant is still an option for us too. So if something, Genevieve didn't react the same way to some of the medication as well, I am grateful that we do have another option, even though it's a scary unknown option, that is still there. So I think that's nice.
It's coming towards the end of our time. If there's something you want to tell everyone who is listening today, will listen once it's recording and it's posted online, what would you want them to know?
I think one of the best things somebody told me, I think it was a nurse, and right when I got in the hospital with Sylvie, was that you have to be your child's advocate, and you know your child the best. You're there 24 hours a day, and as much as like divulge as much as you can about your child to the doctor when they ask. Tell them, log things, be on your phone, be diligent, look up different treatments, because sometimes there's things out there that you have to fight for and go, there might be a hospital that doesn't have that exact medication or whatever, and you can call another hospital and get the treatment that you need. So I think just being very diligent, very on top of things. I was very scheduled in everything that I did. I logged everything that I did, so then when I got to you guys, I could be like, she had this much milk at this time, and and then it was weird because on the the 30th she dipped. So why did she dip? So I think being diligent and that and being your child's advocate is the most important, because that's what's going to get your child the best care.
Thank you for sharing that. And I hope you're taking care of yourself as well through this. I think we have to remember that it's a long journey. And I always say to parents, you're going to take care of your kids no matter what, but do remember that you need to also find respite once in a while for yourself as well. This has been great. I think we're to the end of our time, Ms. Farah.
Yes, this was wonderful information and very engaging. I couldn't take my eyes off the screen and just listening really with my whole body. And thank you so much, Ms. DeAngelis, for sharing your story with us. This will help a lot of parents who are dealing with PFIC. And Dr. Coley, as usual, you are the wonderful savior. Anytime I need something big, I come to you. And thank you so much. I know you're very busy, and you donate your time and your knowledge and your experience to us to help our patients. And that is so valuable. Thank you very much. And also I want to thank Albrio Pharma one more time for their sponsorship and their grant, so we could bring information like this to our patients. So now I just have a small commercial to do for Liver Health Foundation to remind everybody of our upcoming cirrhosis of the liver webinar. It's going to be on March 30th from 5:30 to 6:30 p.m. Our presenters are Dr. Sundaram from Cedars-Sinai and Dr. Khan from USC Keck. The MC of the program is Dr. Robert Gish, who is a professor at several medical centers, including UCSD, Nevada, and Loma Linda University. This webinar will offer a comprehensive look at cirrhosis, its causes, treatments, and life after you have been diagnosed with cirrhosis. To register to attend that seminar and also to visit all of our other programs, please visit our website, liverhealthfoundations.org. We are also on all of social media, including Facebook, Instagram, Twitter, LinkedIn, and of course, YouTube. So with that, really, this is the end of our program. Thank you again for joining us, and we hope to see you at the end of the month for our cirrhosis. Good night and stay safe.